Good afternoon. This is Dr. Alex Ehsan. We're going to be talking about mantle cell lymphoma, a slow growing uh, lymphoma that I want to discuss with you. Unfortunately, and immediately when you hear you have lymphoma and you Google mantle cell lymphoma, we always assume the worst. Today I want to tell you a story about a patient of mine. His name is I've made it different. We're gonna call him George, but he's 80 years old, and he still enjoys his morning coffee. Has a beloved daughter who takes care of him, and he cares about how he feels despite battling chronic pain in his legs, and he does as much as he can on a daily basis just because that's his nature. Uh, he had a colonoscopy because of iron deficiency anemia, and they ended up finding mantle cell lymphoma on the biopsy, and subsequently he was sent to us as a follow-up from the gastroenterologist. It is quite often one of those findings where you get a path report that says mantle cell lymphoma and there's no one to explain it to you. So hopefully this video will help you a little bit. Uh, the gentleman that I'm talking to you about had some enlarged lymph nodes in his neck that had grown as well, and they were bothering him, and therefore he reached out to me for treatment options. Mantle cell lymphoma is relatively uncommon type of non-Hodgkin's lymphoma. We believe that initially we used to think they're always aggressive, but over time we realized that some mantle cell lymphoma grow remarkably slow, and one of the most important clues is called Chi67 proliferation index, and this is kind of like a speedometer of lymphoma. If a number is high, then the lymphoma grows rapidly, and if the number is low, then this is a slow growing lymph node and a lymphoma. Generally speaking, when you see 5% to 15%, you're thinking more of a slow growing lymphoma. And so immediately that should give us hope, not because the lymphoma disappears on its own, it's just that it behaves more gently. So what happens next is we don't start chemotherapy immediately. We generally figure out a little bit more about the lymphoma. We give our patients allopurinol, 300 milligram once a day to keep them from developing gout, which is really to lower the uric acid that's going to be released as these cells die. And the next step typically is to do a PET-CT scan and find out exactly where the lymphoma is hiding. So the PET-CT is going to show us the neck, the chest, the abdomen, the pelvis, and all of the lymph nodes, and specifically the lymphatic system. And generally speaking, we have over time done a bone marrow biopsy almost on everyone, mainly because the procedure is very quick. It's done under local anesthesia. It takes a few minutes. And the reason it's necessary is because we like to know if there are any changes that we come up with that allow us to use targeted therapy for the lymphoma. So in a nutshell, what I ended up offering George was to start taking uric acid blockade by taking allopurinol, get a PET-CT scan, get a bone marrow biopsy done, and hopefully we can get the ball rolling. Uh, and if it wasn't for the lymph node in his neck bothering him, probably we wouldn't even act that quickly. But I feel that in his case, having a lymph node above and below his belly button, we're dealing with a stage 4 mantle cell lymphoma, and the symptoms of weight loss, night sweat, fevers, even a drop in the blood count can affect the quality of life, especially in an 80-year-old. So it's very important that we do use targeted therapies, immune therapy combination, and hopefully the genetic testing that we're going to do on his bone marrow, as well as the biopsy he had already from his gastrointestinal tract, is going to give me all the additional information I need. So what I told his daughter basically was, do not panic. The important questions are, what's the Chi-67? What does the PET scan show? What does the bone marrow biopsy show? And I really want you to know that every mantle cell lymphoma is different, every patient is different, and every treatment should be personalized. And I look forward to seeing George after we have the results of the test very shortly, and hopefully we can put him on a non-toxic medicine to get rid of this disease. I hope this has helped George as well as my other patients. I look forward to seeing him and his daughter. And if I'm not your doctor, I'm certain that your hematologist, oncologist is going to be able to take care of you. And please refer to all the details I'm going to put in this uh, uh, video so it can help you and your family members. As always, I look forward to seeing you if you're my patient, and I really don't want to meet you if you don't have cancer, because by definition, you don't need to be treated. Best of luck.